we are tracking breaking news at the White House. Sources say U.S. President Joe Biden told Democratic governors during a meeting that part of his plan going forward is to stop scheduling events after 8 p.m. so that I can get more sleep. Sources tell CNN that comment left several of the governors in the room frustrated. Now, President Biden plans to spend part of this Independence Day holiday in the U.S. with family members who will be critical in deciding whether or not he continues his re-election bid. Publicly, Mr. Biden remains defiant, getting the backing of a group of those Democratic governors who met with him at the White House. But there are those from within his own party questioning the president's mental fitness and calling for him to drop out following his poor debate performance last week. Dr. Sandra Weintraub is a professor of psychiatry and behavioral sciences at Northwestern University at Mesulam. Now, that is the Mesulam Center for Cognitive, Neurology, and Alzheimer's disease. And I thank you for joining us today as we all try and parse some of the latest developments here. We are not going to try and get into a situation where we're trying to diagnose the president. What is happening, though, is that for millions of people around the world, they recognize what happened during that debate, either in themselves or in loved ones. So I want to start from where you would want to start, and that's what the research tells us. You say that any kind of cognitive issue is a matter of age, biology, and luck. Can you explain that?
Sure. Age is the greatest risk factor for cognitive decline. However, as people get older, we know that there are great differences in the way that people age. And so most of the research that's been done talks about average aging, but as you go up the age scale, when you get into 80-year-olds, you have a lot more divergence, so that there are some people in their 80s that are thinking as well as they did when they were 20, and others that are not doing as well. We don't really understand why age is such a factor in this, but that's how it is. And of course, luck has to do with where you land up on this curve.
I know it's been quoted about the president that he's had both the worst luck and the best luck in the world. But leaving that aside for a moment, the White House is now reporting that he was checked briefly by a physician. But in terms of the kind of research that you do, how in-depth is the testing, if anyone wants to know what exactly is going on with their cognitive abilities?
Yeah, that's a very good question. I'm a neuropsychologist, and what I do is cognitive testing, and I happen to specialize in older adults, but neuropsychology applies to all kinds of questions about brain functioning. And the testing is very detailed. It can take 4 hours to conduct a complete examination, which includes not only the testing, but also the history, because history is very important for how you're going to interpret the test scores that we get.
Meaning that you need some kind of a baseline there. I have to ask you, though, how, now that the president is saying he needs to get more sleep, now on prior medical reports, we do know that the president, it's been disclosed that he does have trouble sleeping, perhaps some form of sleep apnea. In your research, he's now saying that he's going to get more sleep, perhaps not schedule events after 8 p.m. In your research, how can lack of sleep really affect cognitive abilities in the next days?
Yeah, my research doesn't directly address the relationship between sleep and cognition, but I do work with a lot of people whose work does. And you can behave in a very scattered way if you haven't had a good night's sleep. It's astonishing how important sleep is for everybody, especially as you get older.
Yeah, it is interesting that he, discloses that he does have trouble sleeping, no matter any kind of jet lag or anything like that. In terms of where this research is going forward, and again, I ask this because many people saw what happened to the president and said either recognize it in themselves or see it in their loved ones. Is there a straight line to this, or do you sometimes have trouble with cognition and then things can turn around in the following months?
Oh, very definitely. There are so many factors that can affect cognition, including, like you say, lack of sleep, worrying about something that's on your mind that just distracts you internally. Lots of For example, if you have kidney functions are off kilter or your blood pressure drops. So there are many, many things that can episodically affect cognitive function, not just what's happening to the neurons in your brain. But of course,
Interesting.
they are getting affected by whatever
Yes.
else is happening.
Yeah, interesting though, because you say that it's episodic, but as well, obviously, age is a factor. Doctor, we'll have to leave it there for now, but really invaluable insight from us, from an educated position, we should say. Thanks so much. Really appreciate it.
You're very welcome.